Good afternoon, everyone. Welcome back to day 2 of Provider Lounge at American Healthcare Convention. This morning we're with Jim Gomez, President and CEO of California Association of Health Facilities. Thanks for coming, Jim.
Pleasure to be here.
Great. You know, Jim, lots of discussion this week on payment reform and education and training and all these obstacles that are happening. Tell us a little bit about your perspective and maybe some specifics you're seeing in California.
Sure. I think for us, one of the keys is that we are seeing both accountable care organizations and managed care organizations come into California in our major metropolitan areas. And part of that really puts the skilled nursing facility second or third in the food chain. And our payment reform efforts on the national level really would provide a SNF-only bundle in which the skilled nursing facility would be able to have an episodic bundle and be responsible for the care in a bundled fashion rather than on a day-to-day basis. We think that's where the industry needs to go. And in California, we're seeing some of those ramifications of ACOs and MCOs, both trying to cut length of stay, and all the savings go to the accountable care organization, none of the savings going to the skilled nursing facility. So we think it's really important that the skilled nursing facility participate in the profits that may accrue out of that.
You know, it's fascinating because in the first 3 pages of the Affordable Care Act, it talks about the 3 entities that can have this, cost savings. Number 1, the hospital. Number 2, physician groups. Number 3, insurance companies. So you're 100% right. The skilled nursing providers are like the stepchild. They're not seated at the table.
Absolutely, and they all live on the mountain. We live in the valley. We get what they give us as it flows down, and I think it's important. The post-acute care that's provided in skilled nursing facilities is critically important to people's rehabilitation. And so it should not be just a cost issue, but it should be a cost and quality issue. California, we've done tremendous efforts on improving quality, meeting quality measures, and we think that the quality that's being provided in California nursing homes is what our public needs, and we can't sacrifice that quality at only the expense of profit. We think that there needs to be a balance, and we think a national payment reform, which would have skilled nursing facilities holding a bundle, is where that would occur.
I agree with you 100%. It'll be intriguing to see how this all plays out. Now, one more question too. What is the feel for the providers in California? In other words, I know they see the challenges, but with regards to the keynote on the amount of seniors that are entering into the baby boomers, with that infiltration into the settings, are they aware of that? Or
Sure.
Is that?
I've been presenting the demographic changes, and 2018, 2019, we really start to see the 84-year-old and older come into the population. And so, yeah, they absolutely are aware of that. But I think at the same time that we're going to have this major demographic change, we're already at 88% occupancy in California. So we're going to have a demographic change that's going to send more people. But people are going to look at reducing length of stay. And secondly, I think technology is going to come in the next 10 years that's going to have an impact. So we need to make sure that we have enough nursing homes and they're of enough quality that it's the right place to be.
Excellent. Jim Gomez, California Association of Health Facilities, thank you so much for coming today. It was great to have you.
Pleasure.
Thank you so much.
Okay.
Thank you.